Greetings, everyone. Welcome to our AO Spine Youth Club Expert Insight Series interview today. Today we are here with Dr. Giovanni Barbanti Brodano from Istituto Ortopedico Rizzoli in Italy. With me on the interview today is myself. I'm Sam, or by my Thai name, Songpum Sanhavirawong. We have Dr. Ozin. You can introduce yourself.
Hi everyone, I am Dr. Ozerin Dostogir. I am working as a senior consultant, spine surgery in our National Institute of Traumatology and Orthopedic Rehabilitation. It is in Bangladesh.
Fantastic. And we have Dr. Mohammed here today. You can introduce yourself, Dr. Mohammed.
Yes, I am Dr. Muhammad Al Hassan Abdullah. I am an orthopedic surgeon from Sudan, originally from Sudan, but I am currently working as a specialist for orthopedic, and sometimes I do spine surgery in Saudi Arabia.
Fantastic. Yeah, thanks for the introduction. And thanks again so much to Dr. Barbanti. Thanks so much for joining us today. It's a real pleasure to have you on our show today. So yeah, you can just give a quick introduction for yourself, Dr. Barbanti.
Yeah, first of all, thank you very much to invite me for this interview. Yeah, my name is Giovanni Barbanti Brodano. I'm an orthopedic surgeon, and I do spine surgery since the beginning of my career. I work, as you told, in Istituto Ortopedico Rizzoli, that is a whole orthopedic institute in Bologna, Italy.
Thanks so much for that introduction. So let's get started with our first question of our interview today. So let's get to know Dr. Barbanti a bit better. Dr. Barbanti, what made you interested in pursuing spine surgery?
Yeah, my beginning in spine surgery was just, I think, a joke, because during my residency, I didn't think so much about to become a spine surgeon. But when I finished residency here in my city, Bologna, the trauma center of my city was creating a team that should be treat spinal trauma. So they look for young surgeon. There was a very good mentor there. And he called me and he said, why don't you come on board? And I knew very little about spine, but I was interested. I knew that was an interesting surgery. So I said, okay, let's go. And so I started from trauma. And at that time, I started my career in spine surgery.
Thank you so much for that story. Go ahead, Dr. Ozin, for the second question.
So what was residency like for you?
My residency was a wonderful period. You should know that, I think living in Italy is probably one of the best experiences you can have in the world. And I live in Bologna, that is a wonderful city. I spent my residency here in my city at Istituto Ortopedico Rizzoli, where now I work again. That is the most important and the biggest orthopedic institute in Italy. So we have a lot of departments and a very special surgery, especially tumor surgery, pediatric orthopedic surgery. So I saw incredible cases there. I had a very, very important professor and scientist teaching me. So my residency was absolutely one of the best experiences I can have in my life here in Bologna.
Fantastic. Dr. Mohammed, go ahead with the third question.
After finishing your residency, what was the journey was like before becoming a spine surgeon?
Perfect. Yeah. So when I finished my residency, I spent 2 years in another hospital out of Istituto Ortopedico Rizzoli in another city in Italy. The city was Bolzano, that is at the border with Austria, near the Dolomites in Italy. I was very happy because I like so much skiing, so I spent a lot of time skiing in between my duties. And I spent there 2 years doing just trauma surgery, or general orthopedic trauma. And then I came back in my city, as I told you, and I entered this team that was dedicated to spinal trauma. And there we were 6 people, 3 senior surgeons and 3 junior surgeons at that time. So I got 2 years of teaching. So we have no fellowship in Italy. So it's not in the rest of like in the rest of the world. So there is not a fellowship program, but there is this so-called education. Okay, after residency, you have to take 1 to 2 years of education with senior surgeons, and I had my education at that time doing spinal trauma, and I worked every night probably because we have to do trauma during the night because during the day the OR should be free for elective surgery. So we went there every night, but I was young. I was very, very happy to be there in the night because I learned a lot. And I started to operate from the cervical spine to the sacrum, posterior, anterior. So I had a great, great journey at that time. And after the 2 years, I started to be, a senior. So I was lived alone with a younger one. And I started to do also elective spine surgery. My mentor was a very expert on spinal tumors, so we do also a lot of surgery on spinal tumor during the day, and during the night we continue to do trauma.
Great. So, thinking about your professional journey, who inspired you the most become the surgeon you are now, and why?
This is a good question, and for sure my great inspiration came from my mentor, who was Stefano Boriani, that he is still a very important person in the AO Foundation. I think you know him. And he was a great surgeon and also a great scientist, and inspired me both in doing surgery in the best way and also to do research, education, trying to publish paper. And for sure, in my spine field, the most inspiring person was him.
Regarding your practice, what type of cases, the most common cases, and what's the environment like in your institute?
Perfect. Yes. During my career, in the first 5 years, I did mostly spinal trauma. And after I started to do a lot of surgery on spinal tumor, both primitive spinal and metastasis, because working with Stefano Boriani, he was very, very expert on this field. So many cases came to us. So I started to treat this kind of pathology, and I learned to do very important and huge intervention of spinal tumor. And after this first 10 years divided between trauma and tumor, I also started to do much more degenerative spine disease and also deformity, because in 2007, I came back to Istituto Ortopedico Rizzoli and I was enrolled in a team that was treating spinal deformity, both the adolescent and adult spinal deformity. So at that time, I started to treat this pathology. And now probably the most of my surgery is exactly that one, degenerative spine disease and adult spinal deformity.
So, what area of spine surgery research are you nowadays most interested and engaged in?
Okay, yeah, this is a very good question because I was always interested in research. So I did research since the first year, and I had 2 fields of interest. The first was in the basic research. I spent a lot of time studying biomaterials and also interaction with the cells. And then I dedicate a lot of time studying and doing research about mesenchymal stem cells and their use in a tumor or to trying to achieve a better spinal fusion. I did a different project about this topic, and also I published a lot of paper. I was very lucky because when I came back in Istituto Ortopedico Rizzoli, we have a very big department, research department. So I had 2 labs who helped me with researchers and scientists that could help me to let grow this field of basic research. In the other hand, I also was very passionate of clinical research, so clinical study on the patients, and my field in that side was safety. Safety because coming on with spinal surgery, I encountered many complications. And maybe now in the last years, I saw a growth of the rate of adverse events and complications. So I decided to spend time in research, trying to find some method and a program or procedure that could be helpful in reducing adverse events and complication and improve safety. So I did some research, some program. Some program about this topic is ongoing now, and this is a very interesting field for me. I think I will spend much more time on this field about safety in spine surgery.
Fantastic. So
Great.
safety is really important in spine surgery, of course. What would be your advice to young surgeons starting out? What habits should they get started with, for example, to be a very safe spine surgeon?
I think every spine surgeon should start from trauma. It's the same for the orthopedic general orthopedic surgery. So if you learn how to treat a trauma, you will learn every kind of approach. It is the very best base to treat also each elective spine disease, absolutely. So if I have to suggest a young spine surgeon, I will tell him to go in a trauma center at the beginning for the first 5 years. About safety, yeah, this is another question, because there are two big fields about safety. One field is technical skills. That means for sure you have to learn a surgical technique, stay with a skilled surgeon and look at them and learn from them the tips and tricks to avoid the complication and adverse events. Learn now how to use technology, because the world changed a lot. So we have a lot of technologies that could help us a lot, but we have also many complications related to the technology. So to avoid the complication related to the technology, you have to learn how to use the technology very well and carefully. So this is the technical side. But I think it's very important also to have a big think about not technical skills. What is not technical skills? The non-technical skills means planning of the intervention, careful indication, and also big work in OR with your team. So teach your nurse, teach your radiological technician, prepare everything you need before, think about all the adverse events could happen in that case, and design a plan to, first of all, avoid the complication, but second, for sure, face it. Okay, I made an example. If you have to do an adult scoliosis by an anterior approach, you know that the complication could be a vessel lesion. Okay, so from the non-technical point of view, you should have or ask a vascular surgeon to help you, or if you have not a vascular surgeon, you have to be sure that your scrub nurse is skilled on also in vascular surgeon. You have staff to close the aorta or to suture the aorta if something happens. So you should have a clear plan to face the complication during the surgery. And then another important non-technical skill we are using, and we are trying to also improving their checklists. We have many checklists. You know that, I think all of you, that you use the World Health Organization checklist. This is the base. But we have many other checklists to check for neuromonitoring, to check for all the technology are okay. And I think it's very important to use these procedures and skills to avoid complication in spinal surgery. Very, very important field. And this is a lack, I think. I don't know in your country, but in Italy, nobody teach about, in university students, also in the residency program, nobody teach about non-technical skills. So you have to learn a little bit by yourself, this kind of skills. But they are very, very important, I think, in spinal surgery.
I see. Thanks so much. So, any examples of research you've done related to spine surgery safety? For example, were they papers talking about statistics of complications, or were they more about teaching methods? Any examples?
Yeah, for sure. We did a lot of paper about this topic. For example, the program we have now ongoing, for example, is trying to avoid the mechanical complication. Okay, mechanical complication. It's a big field in spinal surgery. They have the third place in the podium of complication. First are infection. Second are neurological complication as rate, and third mechanical. So it's a big field. So you can have breakage of rods and screw, or junctional fracture, junctional disease, loosening of the implants, and this is due to different factors. One of them is the bone quality. So we set a research program that will study patients that are enrolled to be treated with a spinal fusion because an adult deformity or a degenerative spine disease. The patient by different sides. First of all, the bone quality by quantitative CT and densitometry, but also by the nutritional point of view, because this is very important. And also we have we are having a look to sarcopenia. You know now that sarcopenia is coming like a condition very, very important and related to complication in spinal surgery. So we will do a lot of tests about this patient, try to understand if they are not they have not a good quality of bone, and we will try to treat them with drugs, activity, and also special nutrition to improve their quality before undergo the surgery. Okay, because usually in our country they have to wait between 6 and 9 months before to have surgery. So the waiting list is quite long. So we have time to do these things. Okay, so this is a program, but we have also a lot of retrospective study, because there is a lot about complication in literature about technical problems, but non-technical are not very well studied. So we have a look, for example, to patient operated in the afternoon in comparison patient operated in the morning, and we saw that those one operating in the afternoon, they have much more complication, because probably the surgeon are more tired. We don't know why, but we know that this is a data. Okay, so and we try to understand why. This is a point. The time related to the intervention also, it's a big problem. We saw that the complication rate increased a lot after 3 hours of intervention. So this is already known data, but you can also try to plan intervention that not last more than 3 hours. Or maybe you can divide a big surgery into smaller surgery, trying to avoid a complication after the 3 hours, okay? Other programs are try to develop checklists. We believe a lot in checklists because we think that during surgery it's very difficult to think about the cause of the things are happening, but you have just to follow a checklist. So one example is the neuromonitoring checklist, and we use the Michael Vitale neuromonitoring checklist. He designed a neuromonitoring checklist for adolescent scoliosis, but now we are trying to improve and also to personalize, because checklists are should be adapted to your setting. So probably you in Thailand have a setting, in your OR, me in Italy another one, and in Bangladesh and in Saudi Arabia another one again. So you have to check different things in comparison depending on the setting you have. So we try to add every time some new item to check to understand if checking this could avoid some complication or adverse event.
I see. Fantastic. So now, thanks for the responses. Let's get to more of the shield part of the interview. So obviously we like to know our spine surgeons as people too, and as their personal lives. So let's just ask some questions about your favorite stuff. Starting with sports, do you like to play or watch any sports in particular?
Yeah, my favorite sport is ski. I try to ski as much as I can. We are very, very lucky here in Italy because we have Dolomites. So I try to spend 30 to 40 days per year skiing. And another sport I do when snow is not helping me is run. I like running the mountain. So I'm trying to do ultra trail. I don't know if you know what it is. It's running up to the mountain and down to the mountain. I'm not so fast, but I have fun doing it.
Fantastic. Those are really cool sports too. What about your favorite book? Could either be a spine textbook or it could also be like a book that you just read in your free time. Anything you like for books?
I mean, I think the last book I read, it was 10 years ago about spine surgery, because the book disappeared completely. So, now you read just on the web and the paper. I tell you the truth, I follow a lot the AO Spine website, because it's really complete. You can find a lot of information. I miss a lot evidence-based spine surgery. That was a site that AO Spine did many years ago, but now disappeared. And it was a very interesting experiment where I remember researchers, they took the papers from the literature and they tried to resume explaining to us surgeons the level of evidence in a very little screen. So in few minutes you can have a lot of information about the pathology and the importance of the paper. So if I have to choose a favorite place where to read about spine surgery, I will choose AO Spine site for sure.
Fantastic.
Fine. So regarding your whole career, spine surgery career, what is the achievement you are most proud of?
Okay, I think I have one because I think as all young doctor, when I beginning to do my job, okay, I hope to resolve completely a disease. Okay, so I said I hope to let disappear some disease. In spine surgery is not easy, but I have a chance to do something that was very grateful for me. And the story is this one. As I told you, we treat a lot of spinal tumor, and there is a very rare benign spinal tumor that is an horizontal bone cyst. of the spine. That is, I think, less than the 0.2% of all the benign spine tumor of the spine. But we had a quite huge amount of patients came into our institute because we are a hub for tumor. So we saw, I don't know, 20 to 30 patients per year. And we usually treat by surgery, and it was a very big surgery. We started to treat them by selective arterial embolization then. That was helpful, but not always useful. And finally, I started many years ago, I think 15 years ago, a research program about using the direct injection of mesenchymal stem cells into the aneurysmal bone cyst that doesn't respond to selective arterial embolization. And we saw a very important effect of these cells. We don't know exactly the rationale, I mean, the pathogenesis of the functioning of these cells, but they let calcify the cyst very, very deeply. So in 10 years, I tell you the truth, we move to use this treatment in all our patients, and we are able to bring them to the complete healing without any more surgery. So when I started 20 years ago, we have 50% of the patients that need surgery for this tumor, now 0%. And this was one of my great results, I think. I follow all the program, and I bring this technology in my department, and I was very happy to do so.
So in this sense, if you could turn back time, what advice would you give to the young Barbanti? What would you like to have done differently?
Oh, I think probably I do the same, but maybe I will spend more time with my family for vacation and with friends, because I worked a lot. And I mean, from the job point of view, I think I was very, very lucky, because I had a very, very good mentor. That is very important, I think, because if somebody teaching you is not so good, you can't learn anything. I had Stefano Boriani, that was one of the best I can have in the world, I think. And also I spent a lot of time doing trauma. That was very, very important for a spine surgeon. So I didn't change anything, I think.
All right, fantastic. So I think that's all for our interview. So thanks so much, Dr. Barbanti, for joining us today. It's a great pleasure to have you on our show, and we hope to work with you again. Thanks to Dr. Ozim from Bangladesh and Dr. Muhammad from Saudi Arabia too. Thanks for all your efforts interviewing. And yeah, don't forget to follow us for AO Spine Youth Club, both on our Instagram pages and other channels that are coming soon. For example, things like YouTube, possibly TikTok too. So just please stay tuned with AO Spine Youth Club. Feel free to join us, and yeah, see you guys all in the next episode.